Thank you, Nelson. So if you're on your computer, you can see today's meeting overview. We will start with the traditional things, introduction. Many of our members are present here in Medicine Building at the VDH headquarters. So starting with that, I think we can start from the room here with myself. I'm Tony Singh. I'm the Deputy Office Director for Office of Drinking Water here. I joined VDH a couple of years back, and since then I'm dealing with PFAS in one or other capacity. And I'm happy to be here, and thank you so much for joining in and all your cooperation during this work group. I think we can go this way, okay. Jeff.
Good afternoon, I'm Jeff Steers with Virginia DEQ. Glad to be here in person.
Thank you.
Good afternoon, I'm Nelson Daniel. I'm the Policy and Program Director in the Office of Drinking Water.
Jessica Edwards-Brandt, Groundwater.
Steve Herzog with Hanover County's Department of Public Utilities.
Anna Achilles with the James River Association.
Dr. Bill Mann.
Jamie Hedges, Fairfax Water.
Dwight Flammy of Public Health Toxicology.
Thank you, Dwight. And for the work group members who are joining us via WebEx, Nelson, if you could call their names and they can make their attendance.
So we have Dan Horn with us, who is head of the Treatment Technologies subgroup.
Here.
We have Dwayne Roadcap, who is the Director of the Office of Drinking Water.
Thanks, Nelson.
What's Henry's last name?
Rienza.
Henry is with us.
Sure.
Thank you, Henry. Let's see. Leslie Holt is with us today, representing the here on behalf of Bob Edelman in the Occurrence and Monitoring subgroup.
Here.
Mark Estes is with us.
Good afternoon.
And Michael Hoteling is with us.
Yep, Mike's here.
Russ Navertil.
Present.
Philip Muscas.
I'm here. Thank you. Good afternoon, everyone.
Steve Risotto.
I'm here. Good afternoon.
Steve and Wendy Eikenberry.
Yes, I'm here.
All right. I don't know if there are other members of the work group. I'm scrolling through the participants. We have a number of guests with us. Welcome to you. If there are other members, please unmute and introduce yourself.
Anthony Creech, VDH Office of Environmental Health Services.
Chris Harmon, City of Norfolk.
Thank you, Chris.
Anna Jones from the Old University.
Dan Hingley with Aqua Virginia.
Okay, Tony.
Thank you, Nelson.
For those participating by WebEx, if you could enter your name and organization you're representing in the chat, that also helps us keep track of who's present.
Thank you, Nelson. And moving to our next topic, which is agenda adoption for today. A quick overview of what we will be covering in today's meeting is We have an external speaker who will be sharing their state perspective on PFAS in drinking water, followed by VDH updates. We have been conducting this PFAS sampling study that will give a summary of results on that study. And followed by that, we'll have a quick break, and then subgroups will have their report updates, followed by an open discussion. There will be a public comment period at the end of the meeting for members of the public who would like to comment on any of the topics that we will discuss today during the meeting. And do any work group members have any agenda item that they want to add, remove, edit at this time? Okay, hearing none, we'll proceed with the agenda as I just described. Our next agenda item is reviewing and approving meeting minutes from our April 29th work group meeting. Chris Latino has shared all those minutes with the work group members, and those are also posted. The draft of the minutes are also posted on Virginia Town Hall website, and they are also available at request, so if you want. At this time, if any work group members have any questions on those meeting minutes from April 29th meeting, or any objection? Hearing none, we'll proceed with making them as final, and we'll post those as final meeting minutes on the town hall. As I mentioned in the agenda item, we have a speaker, but before that, since we are meeting in both formats today, virtual as well as in person, so some housekeeping items. If our online members of the public and work group members have any questions, they can post at any time in the chat. Nelson Daniel and Chris Latino, they are monitoring it, the chat. And if there's any technical difficulties, please reach out to Chris Latino. And as I mentioned earlier, there will be a public comment period at the end of the meeting. So if you have anything, if you want some specific time, please mention that to Nelson Daniel in the chat window. So moving on to our next topic, which is our external speaker series. Today we have Rebecca Ann Warnes with us virtually. Rebecca is a natural resource planner with the Maryland Department of Environment Water Supply Program. And since joining the department in 2019, she has been involved with a variety of initiatives, such as priority source water protection under the 2019 Farm Bill. And she is also participating in MD's Water and Science Administration Climate Change Work Group. And more recently, she is organizing and implementing the PFAS sampling program in state of Maryland. They have recently come up with the phase 1 testing result of their study. So Rebecca will be sharing some of their testing scenarios and thoughts on that process with us today. And at the end of Rebecca's presentation, we'll have a question and answer session. And if you have any question during the presentation, please feel free to mention that in the chat window. With that, I'll send this over to you. Rebecca, are you there?
Yes, I'm here. Thank you for that introduction, and also the opportunity to speak today about Maryland's initiatives statewide, and then also from a drinking water perspective. I just want to make sure that everyone can see my screen right now.
Yes, we can.
Okay, awesome. Sorry, let me just put it in presentation mode real quick. So like Dr. Singh had mentioned, I'm going to be talking today about some of the previous work that Maryland has completed in terms of PFAS in drinking water, some initiatives that we have underway, both from a drinking water standpoint and some other current studies, and then some future initiatives that the department is considering moving forward with. Before I get into all that different work, a lot of times when we prepare for these presentations, we get the question of, okay, what are the problem areas? So generally, as I'm sure many of you already know, PFAS contamination is typically associated with a specific facility, whether that's a fire training area, military installation, or industrial sites. And these PFAS releases to the environment can have a localized impact on nearby drinking water supplies. In Maryland, we are seeing this to an extent in some of our sites that have elevated levels of PFAS, but in order to really confirm that these particular sites are the ones impacting our drinking water supplies, we need to undertake PFAS forensics to really confirm that. And then from a national perspective, as well as a state perspective, we're mainly focusing on the contamination of PFAS in drinking water and also accumulation in certain aquatic species. In Maryland specifically, it seems like legacy compounds are the main concern. So far in the first two phases of our public water system study, we have not seen any GenX or Adona detected in any of the samples that we've collected thus far. However, again, to really solidify that conclusion, we of course need more investigation. I just wanted to touch briefly on some previously completed work in Maryland. So 2012 to 2015, just like Virginia, we monitored for 6 PFAS compounds under UCMR3. Under that effort, we only had one detection for a site up in Harford County, which is towards the north of the state, for PFOA at around 20 parts per trillion. And then under that effort, we also communicated things like UCMR3, water PFAS, and also the EPA's health advisory level to water systems, health departments, and other agencies. That time frame between UCMR3 and late 2019, we focused on forming just an internal work group within the department just to start some preliminary discussions about how we might manage PFAS in the future. And the bulk of our PFAS efforts have taken place between late 2019 and now, from a drinking water standpoint and also some other programs within the department. And so between late 2019 up until now, we've planned, implemented, and completed the first 2 phases of our public water system study. And we're planning for the 3rd phase to take place later this year. So now I'm going to talk a little bit about our public water system study. So prior to implementing phase 1, we focused our efforts on collecting geospatial information for over 2,000 potential sources of PFAS throughout the state. I wanted to note that this geodatabase, we have not confirmed that PFAS was used or produced or manufactured or even released from these facilities. These are just potential sites, and neither is that geodatabase complete. So as more sampling analysis occurs throughout the state, we continually update this database and are actually working on putting together an internal pool to be used not only for drinking water studies, but also department-wide studies with regards to PFAS. Then we use GIS analysis to assess the proximity of drinking water supplies to these potential sources of PFAS. This initial GIS analysis was conducted on a statewide focus. So we have community water systems, non-transient and transient non-community systems all being analyzed for their proximity to sources of PFAS. Once we conducted that analysis, we kind of kept record of the types of PFAS intersecting with our source water protection areas. But then we started to break up that large list into these separate bins to help kind of prioritize and figure out first steps of our multi-phase study. The first step of that is figuring out which community water systems might be impacted by PFAS. So we selected all the community water systems that intersected these potential sources of PFAS, put them in one bin. That list included sources from surface waters and then also all groundwater sources. In Maryland, we have a mix of geology, so we have drinking water sources withdrawing from unconfined, semi-confined, and confined aquifers. So to further prioritize our list, we then look specifically at the aquifer and the source water type that the system utilizes. So our first phase of this effort involves sampling and analysis of community water system finished water samples where they're withdrawing from surface water sources or groundwater sources withdrawing from unconfined or semi-confined aquifers. In addition to, prior to implementing our phase 1, we started working with our Maryland Department of Health Laboratories Administration to conduct PFAS analysis under EPA method 537.1. And we also worked with MDH and internally to establish our own sampling protocols to limit the risks of any cross-contamination of PFAS during sample collection. And then in addition to those kind of prior to phase 1 steps, we developed this response plan for when we find PFAS in our initial finished water samples. Under phase 1, we're focusing on finished water, and our response plan is based off of the EPA's health advisory level of 70 parts per trillion. So we're basing all of our decisions based off of the total concentration of PFOA and PFAS. And basically this response plan, which I'll go into in the next slide, just kind of outlines additional actions to be carried out by MDE or the impacted utilities. And we framed our thresholds kind of based off of how our program would respond to MCL violations. So we're using 70 as our action level, and then we go in at 35 parts per trillion with different requirements from MDE and the system. And then this 28 part per trillion level kind of accounts for any analytical variability while testing our finished water samples. So this table just kind of gives a very brief overview of what MDE and utilities do when we find PFAS in the initial finished water samples that we collected on phase 1. So if our initial finished water sample measured PFOA and PFAS between 28 and 35 parts per trillion, we went and conducted a confirmation sample just to make sure that we're not underreporting the PFAS and that we're not missing any potential risk for PFAS. If that sample comes back as below 35, then we just encourage that system to conduct yearly monitoring at that water treatment plant, and also encourage that system to share the results with the department. If either that follow-up sample or an initial finished water sample falls between 35 to 70 parts per trillion, we go in and conduct a confirmation finished water sample, as well as collecting an unfinished water sample from the untreated sources of that respective water treatment plant. And if those samples come back as, again, above 35 parts per trillion, we encourage, if feasible for that water system, to conduct semi-annual monitoring at that impacted water treatment plant, and also conduct a yearly sampling at other points of entry to their distribution system. And of course, encourage the systems to share their results with the department. Now, if we've only had 2 samples thus far measure PFOA and PFAS greater than 70 parts per trillion throughout our first 2 phases, and the process that we follow once those initial finished water samples come back is we request that the system take the impacted water treatment plant or source offline as soon as possible, and then go in and conduct a confirmation finished water and unfinished water sampling. And then once that sampling is completed, we again ask them to keep the water treatment plant offline until proper treatment can take place. In the interim, while the systems are looking for proper treatment options or looking at things like blending their water or acquiring an alternate water source, we require them to issue a Tier 2 public notification to their drinking water customers. And then once they find a treatment technique that works for their system, we then ask that they conduct quarterly monitoring at that impacted water treatment plant. So I had mentioned this earlier about how phase 1, we focused on unconfined and semi-confined groundwater sources and also surface water sources for certain community water systems for phase 1. And what that led to was the majority of our samples taking place west of the fall line, so west of 95, if you're familiar with Maryland traffic. And that's just because the majority of our confined sources lie east of that. So a lot of our southern counties and eastern counties were not included under this first phase. There were a few, and we're looking to have a more holistic picture of PFAS and confined aquifers with the completion of our phase 3 monitoring. But basically these red dots represent potentially at-risk community water system surface water sources or groundwater sources. And then these blue dots represent what we considered reference sites for phase 1. These sites basically didn't have potential sources of PFAS within 1,000 feet of their source protection areas, and they were located in HUC 12 watersheds with 75% or more forested cover. We thought that those criteria would make a good list of reference sites. And under phase 1, we actually did not detect any PFAS in those reference sites. So once we identified the potentially at-risk sources, we then consolidated them by their community water system water treatment plant. So under phase 1, we looked at 129 water treatment plants, which these systems represent about 70% of Maryland's population, just because we tested some of the largest water providers for our state under this effort. So WSSC, the city of Baltimore, Harford County, things like that. And under this phase, we only had 2 water treatment plants that had PFOA and PFAS measure above 70 parts per trillion, 2 water treatment plants between 35 and 70, and only 1 water treatment plant between 28 to 35. And while those levels are our action level thresholds, we do actively keep track of how the water treatment plants are also stratified. So we have a list of how many water treatment plants had their finished water measured between 10 to 28 parts per trillion for PFOA and PFAS, how many were non-detect, and how many were less than 10. And all of that is outlined in our phase 1 report, which is can be accessed on our MDE PFAS webpage, which I can link in the chat a little bit later. After completing phase 1, we shifted our focus into phase 2 from March to May of this year. We used a similar methodology as phase 1, where we continued our monitoring of community water systems just to address the risks of chronic oral exposure to PFAS. And then because of the detections that we found under phase 1, we maintained our focus on monitoring groundwater from unconfined and semi-confined aquifers, and then to assess the proximity of drinking water supplies to these potential sources of PFAS, we expanded our search radius from 1,000 feet to a mile. Some differences between the 2 phases include that instead of collecting finished water samples on this phase, we shifted to collect untreated groundwater samples. And then we did conduct a sampling of select confined groundwater sources just to support our hypothesis that confined aquifers typically provide, a more natural protection to external influences, and therefore we shouldn't be finding PFAS in those select confined groundwater sources, which it was reflected in our results. I believe under phase 2, the confined groundwater sources did not detect any PFAS in their samples. We had no samples measuring PFOA and PFAS greater than 70 parts per trillion, and the majority of the samples did fall below the 28 part per trillion threshold. We're working on a report for this second phase and are hoping to have it published by sometime in the fall of this year. Our next phase that we're planning to implement by late August or early September is phase 3, where we're just gonna focus on sampling the remaining community water systems. So that would comprise of about a third of our sample list being groundwater from unconfined or semi-confined aquifers, a third being groundwater from confined aquifers in close proximity to potential sources of PFAS, and then other confined groundwater sources that don't have potential sources of PFAS within 1,000 feet of their wellhead protection areas. And then also, if we have time and enough money, we may revisit some of the sources that were inactive during phases 1 and 2. So I wanted to touch on a couple of different initiatives that we have currently underway just to highlight how we're taking a risk-based priority approach to protecting public health. So we have implemented and are in the middle of a wastewater treatment plant study where we will be studying PFAS in the influent, effluent, and biosolids from certain wastewater treatment plants. And then while we're monitoring those media, we will also be developing certain action levels to incorporate into monitoring and reporting requirements for these treatment plants based off of the PFAS concentrations found in their influent, effluent, and biosolids. We're also taking a good look at PFAS in seafood. So we piloted an approach to measure PFAS in oyster tissues and surface water through our St. Mary's pilot program. And then we're also integrating PFAS analysis into our existing fish tissue monitoring framework. And then we also conducted additional targeted fish tissue monitoring along Piscataway Creek. And then we're working to shift the fish tissue framework to focus more so on potential PFAS locations. And we're looking at adding some fish tissue and surface water sample sites. And then we're also following the EPA's progress on aquatic life and human health water quality criteria to potentially use in the future for things like fish tissue advisories and other water quality regulations. We're also working on developing outreach documents. So this is a two-pronged approach right now. In Maryland, in October of this year, there's a ban on the use of PFAS-containing firefighting foams for testing and training purposes. So these outreach documents will basically go to any PFAS-containing foam users explaining this ban, what's included in the legislation, and then also some other information about how PFAS is used in foams and some of the health risks that chronic use of the foams may pose. The other outreach effort is for local environmental health directors. So we're providing them 2 fact sheets, one about the background of PFAS and the other concerns about PFAS in private well supplies. Since we've started our public water system study, we've had some private well users reach out and express their interest in PFAS and getting their water tested. So these documents will help communicate the risks of PFAS to these private well owners. We're also looking to incorporate PFAS language into our industrial stormwater permits, and then also implementing a spill response SOP, and then regularly engaging stakeholders. So monthly, we meet within Maryland with different state agencies. So our Department of Health, our Department of Agriculture, Natural Resources, and we just present to the work group about updates that MDE has made in terms of PFAS, and it's a large data sharing work group. And then recently we've started to meet regularly with states within EPA Region 3 to discuss, a wide variety of PFAS topics, whether it's PFAS in drinking water or PFAS in fish tissues. Our most recent work group meeting was concerning Delaware's PFAS vulnerability tool and how they developed that and how MGE can implement that into our future planning work. And then finally, we're continuing to our understanding of PFAS in drinking water, both publicly and private. This is through outreach efforts and sampling. So from a public water standpoint, we have reached out to water systems in the past, asking that if they have previously collected PFAS samples and had them tested, if they could please share that information with us. Right now, we're not considering any samples to be compliance samples. We just want to remain apprised of the latest PFAS data that's out there. From a private standpoint, our outreach efforts can be seen through our development of those 2 fact sheets for local environmental health directors. And then we're also working to construct a geodatabase map prioritization scheme to plan out some private well sampling, which is in the very beginning developing stages. So, and then some other work that we are considering. So back in October 2020, MDE co-hosted a PFAS roundtable discussion with the University of Maryland Center for Environmental Sciences, or UMSCES. Basically, this event just gathered PFAS experts from academia, state agencies, federal agencies to talk about the state of PFAS science, any important data gaps, and then to also solicit recommendations on how MDE should move in the future as we kind of plan out additional PFAS work. And we actually have a report that is publicly available on our PFAS webpage, but some of the recommendations coming from that report is developing a PFAS footprint. So understanding which type of PFAS source, whether that's, PFAS foam applications, biosolids, industrial discharge, which of those sources have the biggest impact to Maryland's natural resources. That's a pretty hefty recommendation and will definitely take a long time to fully develop that footprint. Another recommendation is to assess the impact of Maryland's fresh to saltwater gradient throughout the state and understand how that gradient impacts PFAS fate and transport. We're also considering researching the accumulation of PFAS in certain shellfish, specifically blue crabs, just because of their cultural significance in Maryland and how often, people consume blue crabs throughout the year. And then this is one of my last slides. Basically, Maryland has 2 dedicated PFAS web pages. The first just links users to the department's various PFAS initiatives, so not just drinking water, but there's links to our work with DOD facilities, our St. Mary's and fish tissue monitoring work, in addition to water supplies PFAS webpage. And then that second bullet point is the water supply drinking water specific PFAS webpage, where our roundtable report can be found on that page, in addition to our phase 1 report and results tables can be found there. And with that, I conclude my presentation. So if anybody has any questions, I can take them at this time.
Thank you, Rebecca. This was really great seeing all those initiatives in Maryland, and thank you for sharing those with us. I would start with a couple of general questions, if I may. You mentioned that you will, Maryland will, or Maryland is planning to have phase 3. So, is your goal in Maryland to sample all public water systems, or will it, or did you just prioritize it for 3, 4, 5 phases? And the second part is on the use of this data. Are you using this data for identification of sources, or are you also thinking of taking this for regulating such chemicals in Maryland?
So I'll answer the first question first. Right now, our plan is to sample every single community water system source. And then depending on funding and our agreement with the Maryland Department of Health, take a targeted look at some non-transient and transient sources throughout the state. In terms of our use of the data, we are doing some source identification work with our land and restoration program. So 2 of the sites that were above 70 parts per trillion from phase 1, that program actually worked to start identifying, identifying and confirming potential sources within that may impact those 2 treatment plants. And so we have a good guess that fire training facilities and fire foam application is what caused those elevated levels, but that just needs more confirmation through things like PFAS forensics, where you can get down to, specific waste streams. So forensics can tell you whether or not your PFAS in your sample is coming from, a wastewater treatment plant, effluent, or if it is coming from a foam, it can parse it down to the manufacturer of that foam and maybe even the batch number of that foam. So that's something that, we're looking to do as more funding becomes available. In terms of regulations, I don't believe the department has an intent to regulate these compounds at this moment. And the main reason for that is because our regulation process mimics that of the EPA. So if we were to decide that we're going to regulate PFOA and PFAS today, that would be a 4-year process. And then, when you look at the EPA, they made that determination to regulate these compounds by 2023. So at this point, it doesn't make a whole lot of sense for us to start that.
Thank you, Rebecca. And any other questions from the work group members?
I have 2 questions. When you tested these sites, you were also testing for the new generation PFAS compounds?
Yeah, so we were testing for Gen X and Adona.
Okay, and when you say a site is negative, what is your lowest level of PFAS you're able to detect?
All of our MRLs are within the 1 to 3 part per trillion range. What our MDLs are below. And in our phase 1 report, there is a table that outlines our MRLs and minimum detection limits for each individual PFAS compounds under 537.1.
Thank you. That was a very interesting presentation.
Thank you.
Any other questions?
Yes, Jeff. Yeah, thank you for the presentation. This is Jeff Steers from Virginia DEQ. Just interested in, you said you had roughly 2,000 potential sources when you started the study, and you were kind of mesh that up with locations with public water supplies. How did you come up with that list? What criteria did you use? Or
So that list comprises of, a variety of sources. Military installations is one of them. And then we use SIC codes from different EPA databases to get manufacturing sites where PFAS most likely have been used. So plastics, manufacturing, cosmetics, pharmaceuticals, oil refineries are also listed. And basically pretty much anything that you think PFAS may be in is more or less included in that. Now that doesn't mean that it's complete. So we're continually working to get more of that data integrated into that geodatabase. And the way that we implemented that in our planning process, I'm not sure if I don't think I touched on this during the presentation, was basically we would map all of our source protection areas, both groundwater and surface water. And then we would map the potential sources of PFAS, create a 1,000-foot buffer, and then calculate the intersection between the source protection areas and the PFAS buffers. And then just keep track of the number and type of PFAS sources that intersect with our protection areas. That was for phase 1. Phase 2, we expanded that buffer from 1,000 feet to a mile.
all right, thank you.
So, Tony, this is Nelson Daniel from Office of Drinking Water. I'm curious about the budget, and I guess the state of Maryland established the budget for these projects for each phase, and kind of the scope of what it took to get this done.
So I know that we had some PWSS grant money as well as some money from our DWSRF to fund this work. I'm not sure if I can disclose prices and things like that, but we have an MOU with the state lab to do this work at a rate that's a lot less than what commercial labs are charging.
Thank you, Rebecca.
Dan Horn has a question. He said Maryland is tracking PFOA and PFAS, but testing for other compounds. Are you taking any actions on non-PFOA, PFAS hits?
Not at this moment, just because we only really have, the EPA health advisory level to work off of. I understand that other states have MCLs and other limits for additional PFAS compounds. But we always communicate with the water systems if they have higher levels of things like PFHXS or other PFAS compounds, and just provide them as much information as we can.
Any other questions, Nelson, that you have in the chat?
So Henry asked, you mentioned Adana and Gen X not being seen, but were other 537.1 compounds found in the survey?
Yes. Under phase 1, PFBS was found in a lot of our samples, PFHXS, PFHXA. I believe we had a few PFNA detected as well. Under phase 2, kind of the same thing. The only difference was we had one sample that detected the 9CL compound. But other than that, we mainly had non-detects.
Nelson, do you have more questions?
No, there aren't any more in the chat at this point.
Okay, it's 2:47. Thank you so much, Rebecca. We really appreciate the great presentation, and thank you for sharing that with us.
Thank you.
Okay, thank you. let me share what I have here.
Tony, it's 1:47.
I'm in,
You're wishful thinking.
What did I do? Maybe I need a coffee break. Okay. So moving to our next section, which is VDH updates for this meeting. Under this House Bill 586, which brought us together here, the second ask under that bill was to conduct a detailed literature review and see what other states are doing, what methodology they are using, and compiling that report. We're very pleased to tell you that we have the draft PFAS literature review ready, and right now it's undergoing through VDH internal review. Once that is complete, we will share it with the work group members for your inputs, feedback, suggestions, and comments. And we also ask all the work group members to share any information that you would like the work group to consider for this PFAS literature review report or the final report that is due on December 1st of this year. Some of the information, or I should say a lot of this information from the literature review report will be utilized in two legislative reports. One is House Bill 1257 that is due October 1st, and another one, of course, House Bill 586 that is due December 1st of this year. So before we move to the next section, any question on the literature survey or literature review report? Okay, hearing none, I think we can proceed to the next section, and would like to be as continuous as we can be. So let's see where we were on April 29, 2021, when we selected these 50 water works for our sampling in the Commonwealth. And just to refresh everyone's memory here, these 50 waterworks, they had 17 large waterworks in the Commonwealth. We have prioritized groundwater systems and source water intakes based on our collaborative effort with DEQ. And from this exercise, using this hybrid approach, we identified a total of 72 locations at these 50 waterworks, with a combined total population surveying over 4.5 million. At that time, we did mention this. This is also a repeat slide. We did mention that if VDH receive a request for records under Freedom of Information Act, we are obligated to release these results. And so far, we have received a request for these PFAS sampling results, and we will fulfill that request. We did inform our waterworks of this request, and we did receive some queries from our waterworks. But if you have any, if you need any assistance, please reach out to us or VDH Office of Communication related to any such FOIA request related to the PFAS sampling.
Tony, can I ask if the request was for a specific utility or was it for all of the data?
The request is for the general data, preliminary data on this whole PFAS exercise, not about any specific system. We did mention back in April that this data will not be available via Drinking Water Watch. However, we will have it in a searchable database, and we will this information will be accessible on request. But like other things in life, things don't play out as we plan, and the same hold true for this sampling event as well. We identified these 50 waterworks. Some of the systems, they were unavailable for sampling. Some declined to participate. One system, VDH, withdrew the request. And eventually we wanted to have a number close to 50 for this sampling event so that we can make some conclusion out of that data. So we came up with a second list, an additional list of PFAS systems to fulfill such systems. And as you can see on the slides, so far we have 38 water systems that the lab has already sent the testing kits, and the 7 not responded. We have reached out to them, and I think as we speak, they have also received the testing kits. And there are 5 systems that still decline to participate in this second list. And in the interest of time, we thought that this 45 number, it could be a good number for this sampling event. And
so, Tony,
yes,
is the 38, does that mean you've received 38 have been tested, or just 38 have agreed and some subset of that have actually been tested at this point in time?
Sure. So essentially that we sent communication to these waterworks, and we asked them to sign an acknowledgement and agreement form or letter, whatever you say. And this information was based off of that, and your information is here. So far in this sampling event, we have 45 waterworks that are participating as compared to 50 that we wanted to, and the total number of sampling location is 63 in comparison to earlier 72 that we planned back in April. And the big or million-dollar question is what happens after this PFAS sampling? And at this point, I would like to thank all the waterworks who have cooperated with us in sample collection and timely returning of those samples. And once lab received those samples, they analyzed it and they shared those results with the individual waterworks and Office of Drinking Water. When we received those results, we marked those results as preliminary because we wanted to have our own QA, quality assurance, quality control review of the lab results. And we expect that we will have all 45 system PFAS results in the month of August. And at that time, we'll complete our QAQC review and we'll share those results with the work group in August of 2021.
So the FOIA request is for provisional data. Are you providing provisional data or the QAQC data?
We did reach out to the requester stating the same, that we are still undergoing, the data is still undergoing through QAQC, and the requester mentioned that they would like to see the preliminary data at this time.
Was any reason given why those 5 refused to participate? Was it just cost or inconvenience?
At one system, there was some construction activity that was going on, and they suspected that we may see some false positives. And there were a couple of other systems that didn't give any specific reason for not participating. And since this was voluntary testing program, so we chose to pick additional systems rather than taking more with those systems.
Question.
Yes, sir.
So if VDH is releasing the preliminary data, can you give the work group a sense kind of what they're seeing, what they're going to see? And I mean, is there anything, I'm just kind of curious if it had to be released, which I understand, because we get FOIAs all the time. I think it'd be good kind of if the group knew, a sense of, there wasn't anything there, or we have some, I don't know, whatever you can tell us about the data would be helpful.
Sure.
I think I'm just.
Absolutely. As I said, we mentioned that these are preliminary results, and I'll give a broad overview of those findings in this presentation. And if you need more information, feel free to call me, and then we can talk offline, and I can give you more detailed information.
Sorry,
I'm fixated on those 5 that didn't respond. Were they in one geographic area of the state, or were they spread throughout the state?
I think they are spread out, but Nelson, is that correct?
I'm not sure which 5 it is.
Okay. Yes, sir. I mean, I think they're not in any specific.
So there's not one area of the state that's blacked out to us?
I believe so, but I can double check and get back to you on this.
So can I ask, I know we had a sample that had to be retaken. It seemed like it took a long time to get results from the first round. Do you have a sense of when any of those resamples are going to be back? Are they going to make this August timeframe, or is that potentially a second round of data that's going to get released?
I think that sample is already on the way, right? I think lab received.
I know we took it, but
yeah. So I think once lab received it, that was probably last week. They have 10 days to analyze those samples. So I'm hoping by the time we'll come up with the meeting minutes, we will have that result.
because I heard from a few other utilities they have the same, so potentially multiple situations with resamples.
Yes, I'll go over some of those in the later part of the presentation, but that is the whole process. I mean, that is the whole point of conducting this QAQC, so that we just don't take any number that lab throws at us. We scrutinize it, why and how they came up with that number. So I'll share some of those details in the next section. Any other question so far?
Someone asked if we could share which 5 PWS declined to participate. And I think the answer is I don't know right off the top of my head. And the person that knows is not here at the meeting today.
Sure. I mean, we can certainly, if anyone is interested in that information, we can. We have the information. We can definitely share that information with the PWS. Yep. All right. So our QAQC, we have been mentioning that the data is currently undergoing through this extensive QAQC checks. So I wanted to give you an overview of what these QAQC checks are. Once the water work takes the sample, send it to the lab, what happens to the sample during that transportation. Once the lab receives the sample, they extract the sample, analyze the sample, then what type of quality checks are there during that analytical process, and then lab generates a report based on their instrument, their data. So what type of quality checks do we see in the data? So that's what is mentioned in the QAQC checks. So essentially from chain of custody, we see whether the sample they were received and run within the holding time. They were not sitting there for a month before they run the sample, and if there are any such case, we don't we consider that as invalid result. The temperature of the samples and dilution factors that the lab has used to analyze those samples. And similar QAQC checks when lab receives and conduct their own sample preparation and sample analysis. The lab sent multiple bottles for each location that had a blank, a field reagent blank, and then lab blank. So essentially, we check the data on all those method blanks, what type of numbers did the lab receive reported for those samples, lab control sample and the duplicate of lab control sample, when lab receives it, they spike it intentionally with a known concentration of some PFAS compound, chemicals, and then they see how much of that they can recover. So we do not measure, but we do monitor and review that those recoveries in our QAQC process. In further reviewing our QAQC checks on the reports, if you have seen that report, a typical report can run anywhere between 10 to 50 pages. And we review if there are any hits in the method blank. Blank is just clean water. It shouldn't have any hits. If there are any detection, it means there are some contamination from somewhere. If there are any qualifiers, then we give extra scrutiny to those samples. Why? And then the surrogate recovery and spike recovery, if they are within the permissible limits, and if there is relative percent deviation within or outside 20% between two samples. If they are duplicate, they should be similar to each other. They shouldn't be much different. And again, I'd like to emphasize that whatever I'm presenting today, they are preliminary results with whatever we had till July 23rd. Today is 27th, so it's just hot off the press here. So far we have received 42 water system results, total 58 locations. And we are still waiting for 3 water systems on their results. And we are resampling at 4 locations. And I'd like to be clear on this resampling. It's not because of any high hits or any other reason. They're outlined here that there could be any one of or more than one of the reasons for that resampling at this time. Either the sample or blank, they have detections, or they may have used some dilutions for their field reagent blank, which wouldn't make sense. And in some of the lab reports, the lab mentioned that there were some matrix interferences. We wanted to make sure that if it is finished water, there shouldn't be any such things. So to confirm that, we requested a resampling at that location, at those locations. So any questions on this slide? Okay. And from this from these preliminary results, these are the PFAS detections that are above 10 nanograms per liter. Within the parentheses, their concentrations are also given. For our sampling event, we are using EPA method 533, and we are analyzing for a total of 25 PFAS chemicals. On the left-hand side, EP mentioned as entry points, and on the right-hand side, these are the chemicals that have been detected out of the 42 water systems that we have seen so far. Our PQL quantitation limit varies between 3 to 4 parts per trillion for most of these chemicals. And again, this slide is very preliminary. This may change depending on our further QAQC review, but at this time, more frequently detected chemicals, they were identified PFAS, and perfluoro, acid, and hexanoic acid. Those were the 4 chemicals that we have seen in our preliminary analysis as 4 more frequently detected chemicals. But as I said, this may change as we complete our QAQC review, and that will be done in the month of August 2021.
When you say PFOA and PFOS 10 nanograms per liter, is that the sum of both values or each of those 10?
That is the sum, sir.
Sum.
Yes. And for example, in the 4th line, there is a higher number, but yeah, this is the sum of those 2 chemicals.
Tony, sorry, on the previous slide, so there are a total of, it's like 1, 2, 3, it looks like there are 4 places sampled that have PFAS. Can you tell us, are those separate sample locations in a single location? Like how many systems are there, if you can share that?
Sure. So these 6 results are for 6 different waterworks. So they are not at one particular location. So they are at different waterworks.
So EP001
Mm-hmm.
is different than EP001 and 2,
Yes.
and then, oh, okay.
That is correct. So usually we gave this notation EPS for entry point at a particular waterworks. Some waterworks, they had more than one entry point, so that's why we designated as EP001 and 002.
So one place had 22 entry points? I mean, maybe that's just how they numbered it, but.
Yeah, I mean, 022. I may have to check on that, but of course, it's not for sure 22. Yeah.
Thank you.
And so EP002 and EP002 are 2 different sites.
That is correct, sir. These are 6 rows for 6 different waterworks.
Out of 42.
Out of 42 that we have.
14%.
And these detections are above 10 nanograms per liter. So just right. We wanted to generate this plot, but as I said, we have very less data at this time. We are currently conducting this QAQC review. So maybe I'll share this in our next presentation. The next steps on this PFAS sampling study. So here I'll stop and see if anyone has any further questions.
The obvious question arises in my mind, are those 6 sites clustered, or are they dispersed widely throughout the state of Virginia?
They are dispersed. I mean, I'm not sure widely, but they are not at one location. They are not in southeast. They are not in southwest. All of those 6. They're not in northern part. I can tell you that.
They don't share the same source water.
We are still evaluating that.
I'm sorry, I didn't hear the question.
Do they use the same source water? That was the question. And that is why I've said that we will be taking a deeper look at all these hits. Then probably we'll be evaluating the source waters or other sources for that contamination or those detections. But as of now, we have not done that analysis.
When it comes time for the report, will you be able to identify why that site was chosen? Like what was the risk factor for why we ended up selecting that site?
So remember we did population size, proximity to a potential source,
right,
and then surface water sources that weren't otherwise covered in the population sample.
Right.
So
I just wonder how specific can we be if it happens to be a site near a potential source, and that was, the airfield that we thought foam had been sprayed on in the past. Could we put that into the report, or would that be a detail beyond?
Well, we'll certainly be able to look and see. It'll be this waterworks had this result, and you'll be able to put it in whichever category it came in, and be able to say this one was near a potential source.
Okay.
And then I think that's where we work with DEQ to trace that back and to do the forensics that Marilyn talked about. But
those sources represent manufacturing sites, waste collection area.
So it was unlined landfills,
and
airfields with potential for aqueous firefighting foam, and then some industrial sites. And then it was PATWs that treated water from potential sources. We don't have any known sources, and I think there were military facilities in there.
Okay.
And adding to what Nelson said, for this report, I think we may not be able to point the exact source, because that would definitely need more detailed investigation. This is just one sample at one time. But as Nelson mentioned, we did prioritize it at the beginning, and then we can definitely say if this is a particular waterworks, why we selected it, and what could be the factors. But again, in this preliminary analysis, or even in when we designed this study, we didn't include the whole gamut of things. I mean, we just added 2 or 3 criteria. So I think a more deeper investigation would be helpful, and DEQ may be looking into that as well.
Can I add just something real quick to that? At DEQ, we're getting ready. We've been working with Virginia Association of Municipal Wastewater Authorities, BAMWA and BMA, we're getting ready to do an electronic survey of all of the utilities where we identify potential industrial sources, as well as our direct 50s industrial dischargers and stormwater dischargers. It's kind of a comprehensive survey asking about historic and current processes and uses, and so that's just another layer that we're hoping to layer onto this going forward.
Just so I understand this, is the report going to say, I mean, so for example, like Richmond is a large population center. Is the report going to come out and say Richmond was sampled and this is what their levels were? Is that the level of detail that's going to be in the ultimate report?
Yes.
Okay. Yes. Thank you.
So I think Ms. Warren's, our earlier speaker, she talked about how in Maryland they were thinking about or doing, I'm not sure which, but they were doing a forensic analysis where they would be able to tell, is this firefighting foam, is this, or is that,
DNA.
which
Yeah.
batch? And, and one of the things I was wondering if we should include in this report is just something along the lines of, we think would be a good idea maybe for Virginia to undertake that type of study, and it's going to cost us $1 million to do it. I don't know what it would cost to do it, and we have these areas because obviously everyone's going to have all these questions, and we're sort of knocking on the door there, and the real answer is going to be we don't know. I mean, at the end of the day, and I'm just wondering if part of this report could be, and again, I'm just listening to what Ms. Warren said, we could do something like this, but it would cost us $1 million to do these dozen sites, these 6 sites, whatever it is. I'm sort of thinking that might be just a good thing to include, and whether that would fall under the DEQ or whether that would fall under the health department, I don't know, but it seems like that's something that the state would need to take a lead on.
The report that you just discussed, I think may shed a lot of information about that type of source materials. We don't know until we see the report, but.
Right, I mean, we're asking specific compounds plus known formulations of trade name like Gen X, but other ones, we've got a whole list that we'll ask for that information. And we don't see that as a voluntary thing. We have the authority, the utilities have the authority to ask for, because we had this discussion, but it's going to be expected that if you're an industrial user and we've identified you with your SIC code, that you're going to answer the questions. So we'll just have to wait and see. But
And Steve, on your question, adding that section, I think that is a great idea where we can make some recommendations for future detailed investigation so that we can pinpoint the sources for such contamination or in that particular area. So I think we could definitely do that. And in the later part, I mean, I can share that with you now that for these reports that we're talking about, for House Bill 1257, we may not have time for a review of that report in this at this platform, but for House Bill 586 report, we will definitely get it vetted with this work group. You will have an opportunity to review it and then comment on it before we submit it. Right, Nelson? Is that correct?
That's the intent. We've also got 2 questions in the chat. Are you keeping an eye on that?
No, actually, if you can.
1257 is the MCL recommendation.
1257, so the report on House Bill 1257 amended section 169, will amend section 169 of Title 32.1, adding subsection 2, which requires the commissioner to set regulatory limits for PFOA, PFAS, 1,4-dioxane, and chromium-6. That's effective January 1, 2022. The report that's associated with that talks about the board's progress, or the board's, I forgot the exact language, but something about the board's development of MCLs for those compounds. With the inherent conflict of the legislation is not effective until January 1, 2022.
And that, Nelson, this goes to my question, which I know it doesn't go into effect, but there's also a time period that the board is going to have to decide, okay, this is the numbers that we're going to use, you have to get public comment on it, and then they have to be adopted, right? So my question is, if January 2022 is that time frame where they have to be done, and I don't have it in front of me, I don't remember, but if that's the time that has to be done, then what time does the board actually have to start saying, okay, this is our number? If you know.
I think the board has to follow the Administrative Process Act to promulgate regulations.
Would that be a direct final since it's mandated by the GA, or does it go through the whole process? That's, I guess, I wondered that. This could be a 2 to 3 year process.
I don't see an exemption to the APA, the enabling legislation.
Right. Okay.
And does the number have to be like adopted by January 2022? Okay. Yeah.
Does anybody have the answer to that question?
We
We
can.
kind of danced around it a lot. I'm just curious.
Any, you had some question?
Yeah, I'd rather. So we had 2 questions. How are the results that are below the reporting level being handled? For calculations, are they set to 0?
So essentially, in our co-op, we did mention that what number will we be using for our data review, and in that we mentioned that any detections above our PQL, in this case, which is 3 to 4 parts per trillion for most of these chemicals, that'll be used. If there is a number that falls below PQL with a qualifier, as of now, we are not saying that is a confirmed detection, if that answers.
So we're seeing undetected and above the method detection limit, but below the practical quantitation limit.
Yes. So essentially, if the number is between MDL and PQL, there will be a U.
No, it's an I qualifier.
I qualifier. But if it is detected, then you know.
So what are those 2 numbers?
Yeah, this is Mike Hotelling.
Bottom's 3 to 4.
Hello?
Go ahead, Mike.
Yeah, that was my question. If you're going to do any statistics on the data, whether average or standard deviation and so on, you need a number for below the reporting limit. And typically, by tradition, it's used at 0, but I'm just throwing open the question, what number are you going to use for doing any statistics on the below the reporting level data?
Unfortunately, our occurrence and monitoring subgroup lead is not in today, so we can definitely get this question to that subgroup lead and then find out more information. At this time, we are just reporting the numbers that are above PQL, at or above PQL.
Okay, thank you.
PQL is 3 to 4.
Yes, sir. It varies for different chemicals.
Okay.
So we have a table.
Just getting a ballpark. Right?
Yes. Yeah.
And then the other question we had is Of the results above 10 nanograms per liter, what proportion of sites were surface water versus groundwater?
We are still doing that analysis, as I showed that one blank slide. So hopefully in our next presentation, we will have that distribution and some more data analytics on the exact locations, the number of locations with PFAS, PFAS, and some more data analytics that'll be coming. At this time, we are still reviewing the data. So this was a very preliminary data that we have received, and we wanted to share with the work group and member of the public. Right, sir?
Yeah, one question. But for the 1257 report, I guess that's just a literature review. We're not making a recommendation.
The 1257 report will talk about the status of the board's progress to promulgate the standards.
Okay.
I don't anticipate that it will have any limits in it, because this work group and this study, which is not complete, is supposed to inform the board's decision in promulgating limits. And without data and results and analysis.
Okay. Just want to make clear that we're not going to. Okay.
Awesome. So I think we're running 10 minutes late. So how about if we take a 10-minute break? That's the best way to capture the time, right? That was a joke. But let's take a 5-minute break, and we'll be back at 2:30. Right?
Okay. I'm going to stop the recording or pause the recording while we take a break.
Okay. Thank you.
We're recording time.
Thank you, Nelson. Okay, welcome back. And in this section, we'll start with our subgroup updates. With a huge thanks to our subgroup lead for all the good work, and subgroup members. So we'll start with the PFAS health and toxicology. White, over to you.
Thank you, Tony. So I have a few of the members in the room here with me from the subgroup meeting. So I'll start off, and if you guys think I'm missing anything, or anybody on the phone as well, just please join in, because we want the whole group to know all the great stuff that we've been doing. So I didn't realize the last time the whole group met was back in April. So I'll begin with what we went over in May. In May, we had, as you know, Old Dominion University was doing a literature search for us, and looking at state MCLs and making tables for us, because if you try to look at what the states are doing, it's kind of, it's really a pain unless you get the stuff side by side. So they were a big instrumental in helping us do that. We've also had some of our work group members, Paul and Ben, help to reorganize those tables to meet the subgroup needs. We also, at the same time, during our May meeting, funny enough, the day before that meeting, ATSDR, which is the Agency for Toxic Substance and Disease Registry, which is CDC's toxicology branch, came up, or they finalized what they call their toxicological profile. So they did this for a number of PFAS substances, which includes the ones that we're looking at, and probably a handful of a few others. Just keep in mind, if you ever are to look at their numbers, theirs are MRLs, which are used totally different than what EPA uses for a reference dose, which is then used to do an MCL. I mean, they're similar in nature, but don't take them one for the other. And we also had received a request from a member of the public if he could give a presentation that was titled "Determining the Maximum Contaminant Level for Endocrine Disrupting and Carcinogenic perfluorinated alkyl substances." And so that individual, who worked with a number of, I believe, cosmetics and so on, the toxicologist gave that talk, and led to some good discussion. One of our members continues or is asked again, what is expected of the subgroup? So make sure we all get that. We're having technical difficulties if you're not in the room.
No, go ahead, Dwight.
So what we want to make sure is our members keep asking what is expected of our subgroup when it comes to MCLs and so on. So during our June meeting, the subgroup discovered different things that were starting to, we had some questions, particularly me. What do we consider to be a chronic study? Because when you look at developing drinking water, MCL, these numbers are low in nature, partly because you're consuming it over a lifetime. It's not a short one-term slap in the face. It's kind of like a pecking that just goes on and on for your whole life. So, so that was one of the things that we were discussing during our June meeting. We also looked at, we went and had a more detailed look at ATSDR's PFAS and PFOA, what was in their toxicological profile. We then were presented with the critical studies that were used by the states and EPAs, and of course ATSDR for PFAS and the PFOA animal studies, because these studies come from the MCLs and the reference doses and all come from animal studies. So we did that, and at the same time, even though Drexel University released a PFAS report for Pennsylvania earlier this year, our group, an email was sent out for everybody to take a look at that, and it brought up a good, some good discussion that we had with, you know, the difference between a chronic study and just calling something a chronic effect. We talked about some of the states and how they're using uncertainty factors, and even though most of them come up with essentially the same total number, which is around 300 for uncertainty factors, and uncertainty factors, just real quickly, is like you have a number that you get from an animal that you maybe not, you don't see an observed effect. So then you say, well, let's say if we take tenfold, divide that by 10, we can say that'll make it safe for humans, going from an animal to human. Well, maybe we'll divide it by another 10 just to make sure that, you know, if there's any special populations that have some special needs are safe, and so on and so on. So that's what the uncertainty factors are. So those are really come out of professional judgment. And so we've been discussing the use of those, because that's really where it boils down to where the states are primarily different. And then the group also at that time said, you know what, we said early on that we were going to focus on PFAS and PFOA because, you know, we needed some time to learn a bunch of the different toxicology. However, we think we're ready to hear about the other compounds that were listed in one of the bills: PFBA, PFHPA, PFHXS, and PFNA. So that was part of what we were planning on doing for the next. So they would discuss that we should do that during our June meeting. And then the group also discussed what do we submit to this work group. So we did discuss that there's a literature review being done, which by ODU, they're looking at stuff because largely the toxicology is based on what is the literature's out there. So we're fortunate to have that university that Tony was able to find to actually do this and compile this information for us. So one of the thoughts was, at a minimum, we should at least provide a reference dose, and others were thinking, well, you know, maybe are we supposed to be providing an MCLG, which is the goal, which is not necessarily an MCL. And then one of the members wanted to know why the subgroup isn't looking at what other states were doing developing MCLs, because we focused primarily on MCLs that states that already had them primarily, and we may have, I may have just one or two, but we looked at Massachusetts, Michigan, New Hampshire, New Jersey, Vermont, and New York. I think there may be Wisconsin or one other state may now have MCLs.
California.
But the thing, I don't think California necessarily had an MCL, so that was one of the reasons why I had left them out. But Steven suggested that we should look at those because we may be missing things that some of these other states are doing just because they don't have MCLs. Another member, Paul, keeps pointing to that we should make sure that we stay abreast of what the European Food Administration study does, because that's a big document, and they've done a lot of, I believe, more recent stuff. They looked at the science that was newer.
This is Paul. If I may, it was also pointed out in one of the other meetings that, in fact, the ATSDR final meeting actually updated and did cover a lot of that stuff. So I'll drop the Europe focus.
Okay. And then, so what we ended up doing after our meeting in June, we said, well, why don't we just kind of these things that are hanging over our head, why don't we break up into groups and everybody just kind of look at things and bring it back to our next meeting. So we had some individuals look at, you know, what is the appropriate length of study. We had another one, what are other states that don't have PFAS MCLs doing? to address it in their drinking water. And then the third one was, how should we use uncertainty factors, and what's the appropriate way to do that? And then finally, the other thing was the group wanted me to talk more about these other 4 compounds. So along came the end of the executive orders, so we weren't really supposed to meet as a quorum or do anything official, I guess, but I told the group there's a lot of learning opportunities in sharing, plus you all spent all that time looking at stuff. So we met unofficially. Those who could make it called in, and it was just more of a sharing of ideas. So I shared with the group what I learned about what states that had MCLs for PFBA, HPA, HXS, and PFNA. And what we learned was that nobody has an MCL for PFBA, at least the 6 or 7 that we're looking at. The ones that do have MCLs for the HPA and the HXS and the NA were largely part of some of them, a couple of them, Michigan or Massachusetts, I forget which one, and also Vermont. They grouped them. It was always a sum of 5 or 6 compounds, couldn't exceed 20 parts per trillion or something similar. And then PFNA was really the only one that had a lot of literature out there, and that was one where it was mostly spearheaded by New Jersey because they found it, and they were looking at it for whatever chemical release of what was in their drinking water. So that's where we left that. As far as the groups moving forward, according to this timeline, something's got to be done by October 1st. And I think we're still, a couple steps shy of determining, what does the group want from us, and if are we ready to present something to the group. So if Dr. Mann or anybody on the call, or Stephen or Paul has something else they want to add that we did.
I do think that's the $1 million question that we've been always, what is the end product of this group?
Right.
In terms of the overall arching mission of the entire work group. Are we to, anyway.
This is Paul, and just to sort of echo that, the law requires the work group to do sort of the heavy lifting, and the subgroups are sort of here to help. And so I guess, I'm not a member of the full work group, so I have no say at anything that goes on, but I guess what I'd offer is to the larger subgroup, or to the larger work group, please let us know what you want us to provide. Because, we can get a summary of what other people have done. We can also give you an idea of what the goal should be, or the MCL should be. There's pluses and minuses, pros and cons, or whatever, but, whatever the work group would like to see out of the toxicology work group, it would be great if we knew exactly what that was.
I can start with that, and feel free to chime in. So what I think right now is, right time for toxicology group to share all the information, because so far most of the focus was on occurrence and monitoring work group. We wanted to see what is out there. What type of PFAS chemicals do we see in the Commonwealth? Although it's a very limited study that we're doing, 45 systems out of 2,800 systems in the Commonwealth. I'll not say that by any means as a comprehensive study, but once we have data on the occurrence of these chemicals, once we know at what locations detections, and more importantly, what chemical species have we detected, if toxicology work group can say their toxicological profiles. For example, perfluoropentanoic acid. That is not one of the 6 chemicals that House Bill 586 asked us to do, right? But in our sampling, we have figured out that it has been detected at a couple of locations. I was thinking that now once we have this occurrence data in place, clean and cleared from this QAQC review, we can take that occurrence data, we can get associated toxicological data, and if, for example, White had just mentioned that for PFNA, PFHXS, or HXA, P4, PFAS, those 5, other states have done, they have used some methodology to come up with their numbers. So any recommendations or any suggestions from the subgroup on the toxicological profiles, or other states' methodology. I think that will be a big help. Once we club these occurrence and toxicological profiles together, I think then it will be up to the subgroup in what direction do we want to go. Whether do we have enough data on the occurrence of these chemicals? Do we have enough data on the frequency of these PFAS analytes? Are those toxic? Are those mobile? And do we want to regulate those? If yes, then is there a number that makes more sense? Because different states have different numbers. So I think most of that path moving forward, to me, will be dictated by the toxicology of these chemicals. Because if there is a chemical that is present at let's say, I'm just picking up a number, 30 nanogram per liter, and there is a second chemical that is at 15, but 15 is more toxic than 30, I think we should pay more attention to that. So, and that decision is only, I think only toxicology subgroup can help us in that type of information. With that, I'll stop and further.
Comparative toxicology of the PFAS compounds is a very difficult area to look into, because the testing and the models used aren't always comparable, and the endpoints are not even comparable. So when you're trying to compare them, if you have different models with different endpoints, it's not really a comparison, I guess it's sort of a, here it is.
And to follow up on that as well, what I think the subgroup could do right now is be able to tell you, for a given PFAS compound, this state, and this state have implemented MCLs, and this is the data that they used when they reached the determination of what those numbers should be. Now, I'm trying to do this from memory, and one state had decided to include, I think it was PFHXA, as one of it was within like the 5, there were 6 they were lumping together. And when you dig into the data, they don't have any. They just said, well, we think it's going to act approximately like PFOA. Yeah. And so that's the kind of thing where we can come out and say, if you want to put, I think it's PFHXA, if you want to put that on there, you want an MCL, well, another state has done it, they really don't have any data, right? So that's the kind of thing that I think we can do.
They don't have any science.
No, that's right. I mean,
so it's like, and I could have them wrong too. Sure. So it's kind of like you have PFH, help me with the 7, that's the P. PA, so that's heptane, so that's, you got 7 carbons. Mm-hmm. One state compared that to toxicology of the one that had 6 carbon, the other one compared to the toxicology of the one that had 8 carbon. So how do you do that? Is that it?
That's it.
So it's like, how did you pick which one? Why don't, I mean, it's just
exactly.
And then the endpoints is kind of like, I think what Dr. Mann was saying, they're kind of different. I mean, it's.
Yeah, they had data on the 8 and data on the 6, and they said we think it's more likely to act like the more toxic 8. Now, they don't have any data, but on the other hand, like that's also a conservative way to look at it too. I mean, so again, we can tell you that, and we can also, depends on how much we dig into the data, we might be able to say, well, this state decided this number, but then the following state looked at what they did and had problems or had these issues with what they did and then adopted a different number. That's another level of detail too.
Then you have somewhere you'll have one compound, it could be PFNA, which is New Jersey. Everybody just goes, we just did what New Jersey did.
Exactly.
Which doesn't mean New Jersey's right, or I mean, New Jersey probably,
sure.
I mean, they have their own group that just does that, so I mean,
Absolutely, and that is why I'm saying, I think, like once we have this occurrence data, we can see that, what has been detected, at what frequency, what level, and then out of the detection, I mean, that is one way to look at things, that whatever has been detected, let's focus on those. Or, again, as mentioned earlier, I mean, less than 50 samples. And again, out of that also, we identified some groundwater system that didn't participate, those were prioritized. So I think like we definitely need some more data on it, but in the given scenarios, I think we may have to rely on this data from this 45 systems. And I expect that to be here QAQC in probably next 1 month. And I mean, it's a chicken egg problem, whether to look for this one or whether to start from here. So I think like what I propose is that we can start with the occurrence data, and then at the same time you have already discussed most of the things related to all these chemicals, which is really helpful. That'll save us a lot of time.
So Tony, we've got 2 questions.
Yes, sir.
Henry asked, are you considering biopersistence and comparing tox values of different PFAS?
Are you considering biopersistence in the toxicity value?
T-halves, T-halves. We do discuss the T-half-lives of these compounds in the systems we look at, but the range of the T-halves depends a lot on the model system you're using.
Correct.
And in fact, within the model system, on the sex of the system you're using.
Yeah, so I mean, for some of these, there's a gender-specific range for half-lives for rats, but not in mice. I mean, there's a lot of complicated variation, and there, there's not necessarily. I mean, some people would jump quickly to say there's not a direct correlation between, long persistence in the body and the toxicology, but other people would say, well, there might be. So it's just, it's included in the analysis, but I don't think there's a clear.
Yeah, some of the stuff just seems to be kind of all over the place. Like, so you'll read one where they say a rat is the bad model because the way it's metabolized is too fast. You should use a mouse, but some people will use the rat model. And then some of the stuff, I mean, you read it till you don't even know, is it really science behind it, or is there some policy pushing people to develop this number? It is what it is, but I mean, you can kind of, if you read enough, as many papers as I have, you can see where some of it's like, what's really driving this.
There's been studies on humans, and they come out with different numbers for half-lives too. So it's not clean and clear-cut.
So the other question is about the literature, and it asks if, to what extent is the pending literature review going to assist in answering some of the questions you have?
So I think, again, Dwight and Paul, would you please chime in?
How's the literature search going to help our analysis?
I was thinking to say this, the literature has been a big help. If anything, I think it's important if you go look at any technical document that is used by any state to support their MCL, it's, the bulk of it is a bunch of literature review stuff anyway. And I think, I mean, if you looking at the timeline we got, I mean, next week is August, September, October. Tony did mention get that literature review out to the group, in August. But it's the first day of August. The sooner you can get it to the group to start reviewing. Because I know I got a handful of people on my subgroup that love to look at stuff, and they provide a good overview. So, the more time we can afford them, the better.
Sure. And to add to that as well, to the specific question about how does the literature help us, one example is, I believe it was the Drexel report from Pennsylvania, and they found a particular study to be very influential in their decision, but the way that they did it was a test that was very confusing. They fed the PFAS to pregnant mice, and then they didn't give any more PFAS to the offspring. And then the question was, and then they treated that as a chronic study, but was it really a chronic study because they were only exposed for a short? And so that's the kind of thing where we can look at the literature and really figure out, okay, do we really believe or what they did, is that credible? That's how we've been using it.
And a chronic study may be defined as 6 months in rodents. But if the animals are sacrificed at the end of 6 months or 7 months, what you're really looking at are the acute effects of chronic exposure. What you really want to know is 1 year, 2 years, 3 years later, what are the chronic effects of chronic exposure? And there's no animal literature on that, but there's human literature that looks at, if we take people who have been exposed to chemicals in the PFAS group for X number of years, what abnormalities do we detect? And those studies are really flawed. Because, I mean, you're going to detect what you look for and nothing else.
Thank you. Any more questions for the policy subgroup?
So this was kind of a follow-up on the biopersistence, and it said, are you considering human biopersistence in the analysis? Long-chain PFAS were limited by EPA because they are biopersistent in humans.
Yes. Yeah, we're looking at that.
Yeah, it's included in the analysis, and definitely other states have looked at that as well.
Yeah.
But again, there's a lot of variation in what those half-lives are in humans.
Okay, that was it.
Thank you, Dwight, Paul, Dr. Mann. That was really a good toxicology lesson. Okay, moving forward to our occurrence and monitoring subgroup. I think we don't have the occurrence monitoring work group lead in the meeting today. So we will pass on to treatment technologies. Dan, are you there? You are on mute.
I am
if
here.
You're speaking.
I'm here.
Okay.
Can you hear me?
Yes, sir.
Okay, Nelson's going to show my slides, hopefully.
Should be coming up, Dan.
Here they are. All right. So this is going to be sort of a short update on what the treatment technology subgroup has been discussing and hearing. So next slide. Just a review of who all our subgroup members are, and I want to thank them. Got some really good input from a lot of folks. So thank you. Next slide. We meet on the fourth Thursday of the month at 10 a.m., typically for about an hour. Since the last full work group meeting, we've had these 3 subgroup meetings. Next slide. And so what we have focused on primarily, we've talked about granular activated carbon, ion exchange, and reverse osmosis. And we've talked about a number of aspects of those processes. And we've had a couple of discussions of case studies, including one in serving a school in Michigan in particular. And we had a lot of questions raised about a lot of these things, and particularly the last 2 items, applicability to small systems, because some of our team members are specifically concerned about smaller systems and the ability to apply technologies at a cost-effective level, and then the impacts on waste and disposal options. That's generated a lot of questions. Next slide. And our last meeting was last Thursday, the 22nd, and Dr. Eric Rosenfeld of Hazen and Sawyer did a really good presentation on a lot of things related to cost issues and factors, and you can see sort of what he covered there. I'm not going to read the slide to you. I will note that he did discuss the use of powdered carbon as a short-term step in a phased approach prior to instituting a long-term approach for treatment. And he talked about some other types of phased approaches as well. So, that was very helpful to remind us that PAC also has a role to play. He did say that PAC is not your long-term solution. It's a step to getting you to your long-term solution. We talked a lot about a large number of issues and gave us some real good examples. He gave us 3 very good case histories, one surface water in Alabama, and groundwater systems in New Mexico and New York. And the small system really interesting, and it was very applicable and caught the members of the subgroup's attention because he talked about a system that's designed for 20 to 40 gallons per minute, which in anybody's book is a small system. And so, he said that their client's directive was that they give them a true small system application rather than a scaled down large system. And those are two very different things, and it's a good thing to hear. And so we got a lot of good information from him, a lot of good discussion from the various members. This was our longest meeting. It went an hour and 18 minutes, so really captured people's attention. And next slide. I believe that the next slide is the last one. Our next steps. I want to credit Henry Brinza for developing an analysis very early on in our work in our subgroup that talked about GAC, IX, and RO, and we've now developed a template to take what he gave us as a starting point to use as preparing summaries and assessments for all three of those options. And so the next step is for me to distribute that template to everybody so that we can start taking Henry's base work and completing the summaries so that we can present those to the full work group. And that is my last slide. That's my update. If there are any questions, I'll take them.
Thank you, Dan. Any questions? Yes, Paul.
So I have a few questions. First, I'm just going to kind of list them. The first one is, what do you expect the output would be of the subgroup? Will individual treatment option, or will the treatment options break down what the options are, preferred options for different PFAS compounds? And then finally, how is this information expected to be used by the larger work?
Well, what we will be including in our assessments will be some generalized statements. We're not going to, no one can say that this particular brand of granular carbon is good for X% removal of compound Z. But what we can do is say things like granular carbon is more effective at removing longer chain and sulfonic versions, but not so good at shorter chains or carboxyl. So, those are the kinds of things that we will provide, because a lot of those decisions have to be made on a case-by-case basis. We are not going to be prescriptive in our assessments.
And adding to that, Paul, I think.
And as far as how do we see the larger work group using those assessments, we're providing input to them so that they can consider and make some decisions about what the larger work group recommendations are to the Board of Health.
So adding to what Dan mentioned, just clarifying it, that the subgroup report may not be a solution to specific particular utility. It will be a general overview of what is technologically possible or available and at what cost, so that Waterworks, they can see that if the PFAS chemicals in their water, they fall more in the shorter chain versus long chain, and what type of concentration are they seeing, and what type of concentration they want to get to it, and then based on that they can do analysis. So it'll be just a guiding document, but not something on the basis of which Waterworks can make their final determination or decisions.
Tony.
We'd be using the results.
Yes, sir.
Yeah, I'm Mike O'Town. If I put my 2 cents in, I guess one conclusion I got from being on the subgroup was a utility that needs to provide treatment for PFAS really need to figure out where they want to dispose of the PFAS. For instance, if you're going to use RO, but you have no feasible way of getting rid of the concentrate, then that's really not an option for you. Same thing with GAC. I mean, GAC is going to have the PFAS attached to the carbon, but if you can't release it to the air when you incinerate it, that may not be an option. So it seems to me the limiting step is how you're going to dispose of the PFAS ultimately. I mean, obviously cost is always important, but like I said, if you're going to do RO and you can't get rid of concentrate, then that's really not a feasible option. I think the other point was anyone who needs treatment for PFAS, you're going to have to do some sort of pilot testing. It's just not going to be plug and play for GAC. Even a small utility would have to do some sort of pilot testing to make sure that the brand of GAC they use and the empty bed contact time and all that stuff is right. That's all I had.
Thank you, Mike.
Isn't part of the larger work group, I mean, when we're recommending, if we're going to recommend MCLs, which I think is part of our charge, maybe it's not, but isn't technology, what technology can actually do part of setting a limit? So again, I heard, well, we won't know if we're going to set an MCL 10, 20, I'm making up numbers there. If there's not a technology that will treat to 10, that should not be an MCL that we're recommending. There again, any MCL that we're going to recommend has to be based on available treatment technology. So I'm hoping that part of this will be for this compound. Here's a reasonable treatment. You know what you can expect out of this treatment for this compound. This is what you maybe can expect for this kind. Because otherwise, we're just sort of throwing darts. Unless you're just in Jersey.
Yeah, I mean, EPA, when they regulate compounds like this, they have a MCLG and an MCL. MCLG is the MCL goal, which is based strictly on health effects. The MCL is based on not only the health effects, but the cost and feasibility of whatever treatments are available. So.
Right, which is, I think, what we're supposed to do. And, you know, I'll say, I know the state legislators set us up for this, but I'm going to make EPA is going to have a huge budget and do lots of science when they go through this process. And we're doing it on whatever it is, $50,000 and a bunch of volunteers. So it is what it is. But I think our report ought to say that. I really do. I think it ought to say, this is not the right way to set an MCL. And as a committee member, I would say that should be the lead-in to the whole report. But this is what you asked for. So we've done our best, but this is the process they set up is not the process we should be using to set an MCL.
And to follow up on that as well, ideally it'd be great. Let's use PFOA, PFAS. We know that's the health advisory limit of 70. It'd be great if coming out of this, the report would say, if we decided to choose 70, that would then impact 2 water systems, and the treatment cost to them would be X. If we then dial it back to 35, then we'll affect 20 water systems or whatever, and then to get all those down to that level, that will cost this much money. So, I mean, ideally, you'd want to know what the decision is going to cost.
Yes, absolutely. And go ahead, Jimmy.
Well, and to your point, we don't know because we haven't sampled every utility in the state.
Correct.
So it's a little And I completely agree with Steve, by the way, the introduction to the report. I mean, I think everybody's worked really hard to get to where we are, but we don't have the resources that EPA has to.
Well, and actually, to follow up on that too, it's not even that we don't have the resources that they do. It's also EPA doesn't have the resources either. I mean, ideally, we drop an enormous amount of money to go develop sampling methods for every possible PFAS and test every location, but that's just not what we have. We're dealing with a shortness of, limited amount of data and time and everything else. So, I mean, none of this is ideal. I'm not trying to point fingers at anybody. It's just,
Again, I think the legislators, they did this, they think it's important, I agree with them, it's important, and there's right ways and wrong ways to do it, and just saying, go get this done in 10 months is not the right way to do it. That's my only point, and we should say that much nicer than I just put it, but we should say that.
So, and just to take us back to like the text of the legislation, we were convened to study the occurrence, right? That's the primary charge, and I think it would be fully appropriate to say we are limited in that study by time, by money, by the number of sites that we've been able to select.
And who responded.
Exactly, and that any full study would require more, and would require more funding and more sites and a more fulsome look, multiple samples. As far as the MCL, we may come up with recommendations for a specific MCL. It's not, I don't think it's a requirement, but I think it's important to list all the things that would go into that sort of recommendation, or should go into an MCL discussion as this process moves forward, particularly under the next piece of legislation, SB 1257. So I don't know that we don't have to craft everything. I don't think the legislator expects us to craft everything in this short time frame.
Yeah. And I agree with that. And again, I agree with Steve that and you, Anna, that whatever this group has done. I mean, I spoke to other states multiple times, all these New Jersey, New Hampshire, Michigan, and you name it, and I spoke to them. And one common theme that they have told us is either they got a lot of funding so that they can pool in resources, or they got a lot of time so that they can go on their own pace. Like in Maryland, they are doing it phase-wise, phase 1, 2, 3, 4, and once they have all the occurrence data, then they'll dig into that field. So I think we would require that.
Tony, Steve Rosato here. Sorry, I didn't mean to interrupt. I just wanted to make a point.
Sure, Steve.
Yeah, I guess, I agree with all that's being said, but I think, based on the preliminary data you represented, I think this group can say that, given the sampling of the 45 sites, which were selected, intended to be kind of representative of the state, PFAS contamination is relatively minor in Virginia, in drinking water sources in Virginia. I think that's a pretty significant bit of information that shouldn't be discounted. Understanding it's only 45 systems, but we went to a fair amount of effort to try and make sure that those systems were representative for the state.
Thank you, Steve. And I think this is a kind of feedback that we need from the work group members. And if you have more thoughts on what should be included in the report, especially House Bill 586 report, we'll once this data is there, we'll soon start drafting that report, and I think that will be very, very, very helpful.
I think. So this is Dwight. I think one of the things is, I think I might have mentioned in the very beginning with, I don't know all the legal terms, but if Virginia's allowed to adopt their own MCLs, does anything in the statute say the process that we're supposed to take? Because if we are, if we don't have a process, or if we're going to adopt what EPA does, one thought and this happened to New Hampshire, if I may be wrong, they passed legislation for PFOA and PFAS and had MCLs for that. They then later proposed regulations for 4 or 5 other chemicals. Well, their Supreme Court shot it down because they did not consider treatment technology and cost. Later on, New Hampshire's legislation made it a law, so they bypassed that issue. But the point is, kind of, I'm thinking piggybacking what other people are saying, we need to say what process we're using. If we're using the EPA process, I mean, I don't necessarily know that the board that we're going to present this to knows exactly how an MCL is supposed to be adopted. So, I mean, to their benefit, we should spell out the process and then how we're doing it. So, and then to jump to the next question I had was for Dan, and I may have missed it. Has he talked about what is the cost of the treatment technology? Kind of like what Paul said, it should probably be laid out in some sort of a spreadsheet. You know, if you're going to be pumping this much water and these are the chemicals you're removing, you can just use this and it's going to cost this facility, maybe the size doesn't matter, X amount of dollars, so that the board has that. Again, if we're following the process like similar to what I believe EPA does, which is you set an MCL goal, which is the ultimate, but you're not going to meet it. A lot of times you get an MCL because it's not based on your goal, it's based on the cost and the treatment technology. So,
all right, this is my co-talent. I mean, theoretically, it should be based on a cost-benefit analysis, right? You figure out what the cost of putting in GAC or RO is, and then on the other side of the ledger, you have the benefits, avoided healthcare costs and avoided cancer cases and all that. So in a perfect world, you set the MCL based on a cost-benefit analysis, right? That's the way it should be done anyway. Now, we've been talking about the cost of putting in JC, but we haven't attempted to quantify the benefit side of the equation. How many avoided cases of cancer, how many cancer cases are being avoided, how many sick days are avoided. We need to tally up the benefits as well as the cost, my point.
Can we get some sort of like explanation or report on what is appropriate to consider in an MCL, like how that?
You mean the process?
Yeah.
Yes, absolutely. There are standard processes that EPA adopts under Safe Drinking Water Act, and then our policies regulation workgroup can tell us more about APA and what is that process. So they are pretty nicely laid out processes. All it takes is that EPA process under SIDWA, Safe Drinking Water Act, is a pretty lengthy process. So essentially, we started with this PFAS back in 2013 through 15. We got the UCMR data, and then it went through the whole 9 yards. And finally, this March, EPA moved forward with regulating those 2 chemicals. And still, it would take probably 2 to 3 years or that much time before we see a number on those 2 chemicals. So yeah, I mean, a brief answer is yes. We have those specific processes, and we can certainly mention those in the report as well. Okay, so it is 3, it is 3 this time, 3:22, and being respectful to everyone's time, and I don't want you to be stuck in Richmond traffic. We will move forward to the policy and regulation subgroup for updates. Nelson?
Thank you, Tony. Trying to master the technology. All right, so I'll provide a quick update on what the policy and regulation subgroup has been working on. We met on May 17th and June 21st, and we'll get together briefly at the conclusion of this meeting. Our discussions in May focused on which we have provided to the local health districts and the waterworks that are participating in the sampling study. And these are the health districts that serve the areas where the sampling locations are. We've talked about the sampling study and the progress of it, and then we've focused on some of the legislative and regulatory action that we've seen in other states and by the EPA. So I'll highlight a couple of things. Rhode Island, their legislature proposed to add a PFAS law when their session began beginning of the year, and it got through their Senate on I believe a 37-1 vote and went to their House, and it was left in committee there, and so they took no action on it, and the legislature adjourned at the end of June. I want to bring this up because we figured out that it was interesting that it would have established an interim drinking water standard and imposed testing requirements based on that, and it was going to be set at 20 parts per trillion and be the sum of 6 PFAS. And it's the same 6 PFAS that Massachusetts is regulating. As I said, that died, or was left in committee. And the other thing that we've seen recently is Pennsylvania, and so in 2017, the Delaware Riverkeeper Network petitioned the Environmental Quality Board to set limits, set a limit of 6 parts per trillion for PFOA, and they said that the rulemaking should be based on a number of factors, and it was more focused on the factors that are considered in the Safe Drinking Water Act. So health effects, technical limitations, and cost. Pennsylvania, as a result of this, or in conjunction with this, did a $500,000 study, and they collected a total of 360 samples from 360 systems, and they did 40 baseline samples. And of course, one of the things we didn't do in our limited study was to do baseline studies. But, that was an important part of what Pennsylvania did. They used EPA 537.1 to test for the UCMR3 chemicals and some others. They completed their sampling and published their results in May, and the results are available on the Pennsylvania DEP website. And they also had Drexel, and the Tox subgroup mentioned this, where Drexel did a kind of a literature review and study of toxicology, because the Pennsylvania DEP said, we don't have the personnel, the skills, and the qualifications to do that, so they asked Drexel to help them with that. And Drexel came back and recommended limits of 8 for PFOA and 14 for PFAS. The Delaware Riverkeeper recently said, no, we think that the limit for PFOA should be 1, or in the alternative, it should be 6. And Pennsylvania has a slightly different rulemaking process than we do, and so their Environmental Quality Board sets, and I guess manages the rulemaking process there for this particular action. And so they voted on June 15th to pursue an MCL for PFAS. And I don't know if they voted just for PFOA or they did PFOA and PFAS, but they voted to begin a rulemaking process in Pennsylvania. And EPA has, and so shifting quickly to EPA, they've been doing, we've mentioned work with TSCA, and so under TSCA, there is manufacturers and reporters are required to provide detailed information. So this is a proposed rule. It's been published in the Federal Register. It's undergoing a 60-day public comment period that closes in August. They also, and they withdrew Trump-era compliance guide that had narrowed, and I don't completely understand this, but they've taken action on 2 other things. On the significant new use rule, and then they added 3 PFAS chemicals to the TRI. There's been no reports or speculation or conversation about where they are with the rulemaking process for PFOA and PFAS. But they are taking other action here, and then the House passed a bill to do something with PFAS last week. I believe. I don't have any updates or information on that. So in terms of next steps for the work group and what we're going to talk about in next steps for the subgroup and what we're going to talk about following this meeting will be to develop state summaries. We will consider input and recommendations from the other subgroups and think about how we might contribute to the work group's objectives, and then I think have a conversation about once the results are available, kind of what we want to do with this. But we like everybody else are waiting as a subgroup to see the results and to start to understand the implications from those. So that's what I have.
Thank you, Nelson. I think we are already running behind, so I would request if you have any questions for the policy subgroup, please mention it in the chat and we'll reply you via email, right? So moving to the, what did I do? Yes, moving to the next steps. Since we have to submit this House Bill 586 report in December, that we usually need 45 days before the actual deadline to submit that report. So essentially, we think that we'll have these results from the sampling study in the month of August. So we are proposing that instead of this quarterly work group meeting, if we can meet in September to discuss the sampling results in detail and the draft House Bill 586 report. The purpose is to have as much stakeholders input in writing that report as possible. And we are marking a deadline for ourselves to submit that report internally as 15th or middle of October. So any thoughts on having our next work group meeting middle of September or second week of September?
Second week of September is in the middle of water jam, which will affect some of us.
Okay. How about before 10th of September? Or maybe
from my
I
perspective,
can send
Tony,
a separate...
that would be better than holding it later.
Sure, absolutely. That's why, based on the feedback from the work group, we can refine it, and again, we can present it to the work group before we submit it to the VDH leadership here. Okay, so I'll send a doodle poll for September, and it'll be between 1st and probably 8th or 9th of September. And then you can give your availability for that, right?
This is Paul. I just throw a wild idea out there. What if we had the meeting during the week of Water Jam in Newport News next to Water Jam? Just could have a lot of people over there.
I'm not sure.
Like in Virginia Beach.
Sorry. Yep. Thank you, Russ.
You're welcome.
Okay, so I'll send the doodle poll, and then we can decide that. And moving forward between August and December is that we have to submit these two reports, and we would like to have stakeholders' inputs in 586 as much as possible. We'll share these PFAS sampling results with all of you in August. We hope to have the draft literature review ready in the month of August. So please look for multiple documents, and would highly appreciate if you revert back to us within the given time frame. And again, please do look for most updated information on our webpage as well. With that, are there any discussion topics in the open discussion forum? Although we don't have much time here. Okay, hearing none, we can go to the public comments. Any members of the public who wanted to comment on the topics that we discussed today? Hearing none. Thank you so much for joining in this afternoon, and please do look for, keep an eye on your mailbox for all these reports and study results and meeting invites and doodle polls. So we'll keep you busy in August, September, October, and thank you so much for your cooperation.
So members
Thanks.
of the policy subgroup, if you'll just stay in the meeting, we'll reconvene. I've got 3:34. I'll give it 3 or 4 minutes. We'll come back. Just stay in the meeting.
Thanks, Nelson.
Thank you, everyone. For just 4 minutes.
That's not bad.
Absolutely. I didn't want people to get stuck on the I-95s and all, right?
Richmond doesn't.
Unless we're in the policy and workgroup meeting, and then we'll get stuck on that. I'm from DC.
Oh, Jessica, you are.
I worked in Northern.
You're on policy.
There you go. As a
From
So the mics are back on. So good afternoon, everybody. Thanks for hanging out for a little bit longer. This is the policy subgroup meeting. I think I have, in the room with me are Paul, Jamie, Jessica, I think Wendy, Russ, and Philip are with us virtually. If I'm missing anyone, please speak up.
Sorry, Steve Rosado was on a call earlier. Is he no longer
Yes,
with
Steve,
us?
Steve Rosado, are you still with us?
I don't see him in the list, Nelson.
Okay. So I don't have a formal agenda for the meeting today, and as you can see, I've just got my presentation back up. I don't have any updates other than what I've seen. And are there any members that have updates from other states that you've been watching or tracking that you want to contribute or share? So, as I said, I think next steps are to develop state summaries. And I know for the January meeting, I had people presented on different states. I can resend that list. What I'd like to do, and I'll put all this in an email, is to get a summary that includes whether or not the state has developed a specific regulatory limit, or if they have an action level of some sort, and then a specific citation to the law and or the regulation that permits that and directs that to happen, so that we can see in part how it's written and how it's implemented. I've looked at Massachusetts and how they laid out their program, and they set the limits. They say what the testing procedure is, and what levels and what triggers and what order you're going to do testing, and kind of how it's going to implement the law. And this is in their regulations. And so that would be, again, a summary of what the limit is and the legal basis for it. And then if there's any other kind of a brief paragraph or two to summarize the process or interesting part about it. And that will, one of the charges in 586 was to look at what other states are doing. And so part of the report will, in my mind, will say, the state of New Hampshire did this. They passed a law, they went to litigation, here's where they ended up, and then here's a link or what it is and the basis for that. As I said, Philip commented that Maine passed a law virtually banning all PFAS, and so if that's in there too. So, my obligations are to send an email with a template and a list of who was working on each state. And as I'm aware of other states or things coming up, like Rhode Island, I've got that, and I'll take Pennsylvania. But if there's anything else that we've missed, get those. And then the third thing I'd like to start thinking about, and I think that this group is well equipped to do it because I think we've got good writers and good thinkers. Kind of bigger picture is to, I think it would be beneficial for this group to start to outline what the 586 report might look like. And to the extent that, again, I'll put in an email, I think a very broad outline, and then ask for your input and your suggestions for how to fill that in. Just because, I think to write a good report, we need to think about what we want to say. And I think the report that the work group ultimately does may or may not recommend MCLs. And that the bill says, and the language of the legislation says that we may recommend. And what we may see from toxicology is if one of the 25 PFAS is detected in one location at a concentration that doesn't show up in any of the toxicology reviews, that we may not want to do anything with that. Or we may find that something is detected in several locations that's not on the list of the 6, and we may want to do more research, or we may recommend that the state do more research to determine if that's a problem. And we may determine as a work group that we don't have enough data to recommend MCLs. And I think that's a fair conclusion. And again, we may find that there's enough of a compound out there that we, as a work group again, recommend an MCL, or we recommend the board develop an MCL without actually putting a number on it because we don't have sufficient data. And so but in order to make those recommendations, I think the outline needs to say we should consider these things before we make a recommendation, or not make a recommendation. Is that here's what we've considered, here's how we went through the process, and to help get to that conclusion and that ultimate point. So the third thing in my email to the subgroup will be you're getting your input on an outline. And we're struggling with public meeting laws and what those look like and how to play in this atmosphere. And so we will plan, I'd like to plan to do our next meeting on our normal schedule. So I believe that would be August 17th. Somebody could check that so that'd be the third Monday in August.
Third Monday's the 16th, Nelson.
All right, then that would be August 16th at 11 a.m. If that's feasible.
I'm going to be out of town, but don't hold it up just for me.
We need your input.
Well, I'm almost a guaranteed show because I live here.
So anyway, I don't know if other members of the subgroup have thoughts or comments or suggestions. I'd love to hear them. I'm going to stop sharing.
It's Philip on the phone. Oh, sorry.
Yeah, please, Philip.
I guess just sorry. I mean, I agree with you. I agree with your suggestions for next steps.
So, not that we don't have enough work to do.
The other thing I wonder if we might talk about is included in the MCL process. Sorry, I don't know if you can all hear me or not.
Philip, we're having trouble hearing you. Can you either repeat or put it in chat and I'll read it?
I'll put it in the chat. Sorry about that.
Sounds like a connection issue.
Yeah, and Philip, I don't know if it's on our end or yours, but let's take a couple other comments and try and come back to you. Please save that. Jimmy, did you?
Yeah, so kind of playing off of Mike Hoteling's comment earlier in the larger work group meeting and disposal of PFAS contaminated treatment residual streams. And we know there's legislation in Congress right now, it may have been the piece you were referring to, that the House passed last week, where, I mean, it would have the effect of making water utilities now responsibility under CERCLA for disposal of PFAS contaminated GAC, the waste stream from RO. We know at least there's one state that's not letting anybody use RO for PFAS removal because they don't know what to do with the waste stream. It seems like somewhere in this document we've been focused on kind of what other states are doing to regulate, but I think having some discussion, even at a really high level, of all of the other things that are going to affect drinking water treatment in terms of regulations, because it's blowing up.
And if I could sort of piggyback on that, one concern might be not just cost, but in the concept of feasibility, the other problem is that it might cost us this amount to install it and to operate it, but the problem that we currently face is that under the current regulatory climate, it may be that the ability to dispose of this, treatment material could increase exponentially over the next few years, given the fact that it's now looking like it's going to be harder and harder to deal with material that contain PFAS. So it's all well and good to say we're going to treat this stuff, and it's not just how much it's going to cost, but it's also the uncertainty of, what are we going to do with it? And that, there is a cost aspect to that, but separately what happens is if you have it and now the state says you can't dispose of it at all,
right? Then
what do you do?
And there was an example, I don't know if you sat in on the treatment technologies meeting last week that Eric gave of that smaller utility, I can't remember what state it was in, Arizona maybe, where when they started their PFAS removal like 3 years ago, they had two options for disposing of GAC. Yeah. And now they're down to one because the second guy said second hazardous waste landfill is no longer taking it, and the price is like tripled or quadrupled in 3 years.
Exactly. Yeah.
I mean, for a utility as small as the one he was talking about, that's you quickly become unaffordable. So balancing, it isn't just cost. It is like as a practical matter. We're not going to have mountains of spent GAC sitting on our treatment plant sites.
Right.
But if we can't get rid of it,
something that I brought up in the work group and that we've talked about a couple of times is what is the charge to the board with respect, and this is getting into 1257, but is what does the loss, when the law becomes effective, what is that going to say with respect to what the board should consider in creating the MCL? And what the law says is different than what the Safe Drinking Water Act says. And that the process that EPA is going to follow to establish its standards. And I'm looking at section 169, subsection 2, it says ABC plus the APA, and it doesn't line up neatly with the Safe Drinking Water Act considerations, which would take more of what you're suggesting into consideration.
Yeah, and on the other hand, though, there's also the customer, I can't remember the phrase now, that the water system has to put out every year, the consumer
competence.
Yeah. So problem also with that is the regulations, which are based on the Safe Drinking Water Act, require that in the CCR it actually defines if there's an MCL, it means this, and it was based on an MCLG. So the concern is, if you send out a CCR, if you pick an MCL, and you don't have an MCLG that was through the process, what happens when you send that CCR out and says it has an MCLG and you don't have one? What's going to happen then?
Thanks for making it more complicated.
I'm sorry. and yeah.
I hadn't even thought of that one.
So, and there's a separate issue that it's not necessarily a Virginia issue, because as I read the rules and regulations, Virginia has far more flexibility in terms of how they want to get down the road to an MCL. The Safe Drinking Water Act is very regimented, and it's not quite the same. But the Safe Drinking Water Act also says that when you pick the MCL, it has to be based on feasibility taking it into, issues of cost and proven technology, whatever. What's really fascinating is it also says, and by the way, GAC is always feasible.
So you can't get rid of it.
So, this is the thing. This is the part that I think is going to be a big problem later. Is it's going to cost a bunch of money, but if Congress says GAC is always feasible, then you can't say something's too expensive if you can treat it with GAC. And that is a problem the federal government may run into.
Well, listening to Eric talk the other day, I mean, some of these utilities have gone to regenerating. I mean, I know like UOSA regenerates their own carbon on site. For me to be able to do that, to have the land use, I don't have the land use right to do that. I gotta go all the way back through whatever local land use permitting, and they've got nothing to measure that against, but they're not gonna want it next to a residential neighborhood. I mean, there's just so many aspects of this that it's not a simple treatment process. It is this moving it from phase to phase to phase, and it's placing the burden of that on water utilities, and that's not where it belongs.
So you guys didn't put it there.
But I think, if nothing else, is an education effort for the board as to, okay, this is we all recognize this is a good thing, and we don't want, if it's causing problems, we don't want people drinking it, but there's all these other things you may not have realized that go along with that. And maybe that results in a little speedier action on some of the regulations related to polluters and that side of the house.
Jeff left. Yeah.
And I think you can keep going down that rabbit hole too, because now if you're regenerating your carbon, what's DEQ going to do for air permits? And it just keeps going down the line, because there has to be some continuity in all of the state agencies that are involved in this. And it seems at this point that DEQ everybody that I've heard has been like, hey, you know what, we're going to wait for VDH to figure out what they're going to do, and then we'll go from there. And yes, you can understand that, but at the same time, yeah, there's a whole lot of things that need to fall in place at the same time, and we can't just wait for that. If we develop this technology and say, okay, here's what we're going to do, well, what if DEQ comes down the line later and says, hey, well, we can't do that, but we've spent $1 million or more to try and come up with these technologies to treat a problem, and now we're spending even more money that we didn't know about to treat more problems. There's got to be more communication there.
And to add to that as well, once you start engaging in a process where you're trying to extract, PFAS from your treatment media, all of a sudden now you can't say you're not a source of it anymore, because you're actually, you are pulling it from something else. And you can say, yeah, it didn't come from us, but all of a sudden now you're actively dealing with this stuff in a way you weren't just filtering it anymore. You're trying to play with it.
Putting it someplace else.
You're trying to play with it, yeah.
I mean, it really does need a more holistic approach.
And there's always the risk we've mentioned before. Congress could decide to say that PFAS and PFOA is part of CERCLA. It's a hazardous substance. How do you deal with the fact that, on average, the rain that falls in the United States ranges from 1 to 3 parts per trillion of those compounds, like literally falling out of the sky? I mean, because it rained on my property, I now have a CERCLA problem? It's a mess.
That means, Paul, we can send it all to you then. You have the CERCLA problem with the rain. We'll give you our waste.
I'm I didn't quite hear what you said. I think that was Russ, but yeah, if we can convince DEQ to open a hazardous land, disposal site, just give it to you. Go for it. Sure.
Yeah. Wow.
Do we have any big quarries to fill in?
No.
Not in
We're
my
not talking
backyard,
Northern
Russ.
Virginia. Talking elsewhere.
Okay, well, we'll help you find some.
Yeah.
Just stay away from
We have
Augusta
quite
County.
a few around here.
So Philip said he agrees with our suggestions for next steps, including developing a report outline, getting more info from the treatment subgroup, and the final sample results will help us. And second, I think it would be useful for the whole work group if we could summarize the MCL development process, particularly when it comes to where and to what extent cost-benefit analysis plays in the process. So, yeah, I agree, Philip. I think that should be a part of somewhere in the report, and it's going to be in the 1257 report too.
I'd say too, at the last meeting, Tony actually volunteered that will be in the meeting, how it's going to be done. So we definitely have to have that in there.
Okay.
But in terms of, I also agree with the format. I will say that they're actually, in terms of the MCLs breaking down with states, the toxicology group has been, as far as I'm aware, collecting all of those states and all of the MCLs and everything, and going through the science to figure out how those MCLs were derived. What I think might be useful, if we're going to create our own table, we may want to maybe start with what toxicology has to make sure that we're not missing anything on the toxicology side. And then also then maybe in the report, in the format, I know we can talk about, later about what the format could be, but one thing could be, like you said, a state-by-state breakdown, and we could talk about how they created the law and where it's found, and then right after that, we could also then throw in, and this is the science that they used.
Yeah, and their MCLs. I think having like one sheet for each state that's got everything is going to be easier to digest.
Well, much easier, and and maybe we have like a summary up front, which is this is the state, this is their MCLs, and then we have more detail behind, again broken up by state. But
and like a little fact sheet for each
exactly.
state.
Executive summary that most people, that's the only thing they're going to read.
Right.
So.
That's great.
In fact, we've got a big spreadsheet, as mentioned before, that we've been playing around with it. We have a big spreadsheet that lays out all the MCLs. It's PFAS by PFAS specific, and it breaks down which state has what and the science that was used for it. So that seems like it would be very easy to sort of plug in or lift that into and your stuff's right on top of it.
Okay. So in coming up with a template for the state report, I'll try and look at the spreadsheet and see if there's a way to add what information do we want to plug into that, or how can we play nice with that without having to duplicate effort.
Right. I'm not suggesting that you need to plug that information into our spreadsheet, because that people aren't going to read the spreadsheet.
Right.
So my larger point is that we have a lot of the information that you want to consider kind of already gathered and arranged. And that way then you can use that as sort of a springboard to figure out what else do we need, what are we missing, and then ultimately when the report is made, we can draw from the toxicology group's data and draw from the policy group's data to put it together.
Okay.
And these are for which states? Do we have I know you have a group of states, but it's not.
Well, I think that was your
It
point to make sure
should
we're
be the
not
same.
missing
Are
anything.
they the same? Okay,
Should be.
all right.
And I think it sounds like maybe there's a couple that have popped since we started that the policy group may not have, unless Nelson's been tracking them independently.
So
It's like Colorado doesn't have an MCL.
No.
But they are doing a lot on the residuals, like on the wastewater side.
and discharge limits, and that's
Discharge limits, so we don't want to miss
that's
that.
a crazy, but see, the problem is that we have not been tracking water quality standards that involve PFAS per se, because really we were focused on the drinking water, efforts. So
It's not a complete picture.
right now, off the top of my head, I know Colorado has water quality standards, and Michigan has been working on theirs. And Michigan started off with drinking water first, and then is bringing in the water quality standards for the discharges. Whereas, like you said, Colorado started backwards, so to speak. So I don't know that we would necessarily include Colorado. We can comment on it. I mean, whatever we want to do is fine. But they don't have a drinking water aspect per se.
So what I'm bringing up is
Just in a bad moment.
I don't like what Colorado did, so that's a separate thing.
Okay.
They use their narrative standard in a way I don't like at all.
Oh, okay.
So, I mean, this is kind of where we are right now with the states. And of course, this is missing, there's not, I don't have science behind this to say how they came up with this, nor do I have what I'm asking for. What I think the policy subgroup can provide is where you find this and where you go to read it and follow it. But this seems to be where we are with the states right now.
So are we proposing to report on PFAS compounds that are not in 586 or 1257, whichever? Not the 6? Are we going to report on everything? Because that list is more than the 6 we've.
I think it's valid to say that so Virginia doesn't include PFDA, and Massachusetts and Rhode Island proposed to regulate it. And I think we should say that yes, it is. These are the compounds that are regulated in other states in some form or another. Virginia has chosen not to do that, or to include a compound that is not regulated in any other state.
Well, we just haven't looked at it.
It's just a statement of fact.
Status.
Right, and on top of that, though, too, we're going to get the results back from the sampling, which is method 533, which is going to include all of these, plus several others that no one's regulated. So we may end up, I don't think it's going to happen, but we may end up in a situation where we find a hit in one place from the 533 sampling that no state has looked at, and then we would just say one place had this and no one's regulated it. There's no science.
And your group may say there's no science,
exactly.
no basis for. At this point, there's no basis for doing anything with this, because we don't know anything about it, except it's out there in one location in this concentration in one sample or two samples, and it may change tomorrow. So, anyway, do anybody else, Wendy, Russ, Philip, Anna, have any other comments or anything else you wanted in the subgroup? And at this time, I'd open it up to the guests that are with us. If you have any comments.
I have nothing additional, Nelson. This is Russ.
Thank you, Russ. If not, I would like to conclude our subgroup meeting and just say look for an email and share your input once you get that. All right, with that, I'm going to stop the recording. I'll have a great week. Thanks for hanging around for this, and